Good afternoon. This is Ned Oshiro. I'm your American English pronunciation coach. First of all, let me explain to you about this latest statistics on coronavirus in Okinawa. So far, the number of infections related to the COVID-19 remain unchanged. That is 142 people and 6 fatalities. Now, that's right. Before jumping into today's topic, I'm teaching English, American English pronunciation to beginners and intermediate level in English learning. So those who don't know what to do about where to start and how to start the English learning, or those who understand what the other person is saying to a certain extent, but it's having difficulty making themselves understood. If you have such a problem, please email me to the email address below. Okay, let's start with today's topic. That is that it's a mystery that Japan's, despite its aging society, Japan reported very relatively low figures in terms of this coronavirus or COVID-19 fatalities and infections. So first of all, when this coronavirus hit Japan hard, it's about late February and March, the Japanese government set up is a criteria which have been adopted right away. That is that they set up the criteria to be eligible for testing for this coronavirus. First of all, you have to have the running as high as 37.5 degrees in Celsius, fever running for at least more than 4 consecutive days, and those who have been abroad or travel abroad lately. And thirdly was that those you think that you have close contacts with the infected person. And lastly is that you suffer from some sort of lung symptoms enough to require hospitalization, right? So this approach was designed not to identify the old infected people, but to rather focus on those most in need of treatment and to trace clusters of infections. These criteria have been adopted in the first stage of coronavirus hitting Japan. But what a lot of people say about Japan being so mystery, why in the world compared with the United States and Italy, which have been hit very hard, strong, devastated by this COVID-19, despite its Asian population, Japan still has reported relatively lower figures compared with these, the countries. So I ponder myself about why in the world that Japan has relatively enjoys lower, I shouldn't say enjoy, reported the lower the figures. I think my conclusion is that perhaps something to do with the Japanese cultural practices. First of all, as you may know, Japan normally bows instead of shaking hands and hugging like the Western people. And secondly, it's we Japanese have a custom wearing face mask whenever you get sick. So whenever you have some minor cold or coughing a little bit, most people wear face masks in order to prevent in order to prevent the spreading of these droplets, spreading that in germs around. So we have been sort of accustomed to wear the face masks whenever you feel a little sick. That's why it's easier for us to wear face masks. And thirdly, as you know, in Japan, normally you take off shoes whenever you go inside the house. So we don't wear shoes in the house. And next one is the cleanness of public toilets and public facilities. I know that the friend of mine was very amazed about this fact that, you know, most of the public facilities and toilets in department store or supermarkets, wherever, are being so clear and clean. And that's the kind of, you know, cultural things for us to do. So it's also leads to clean water and air. And see, as I said, we hardly, you know, shake our hands or hug or giving some sort of, you know, body contacts. Rather, you always keep the distance, so at least about 2 meters away from the person you're talking to. So whenever you meet someone for the first time, or you meet your friends on streets outside, you normally bow. And bowing to certain the degrees, that's, I don't want to talk about it details today though. But anyway, it's kind of customary things for us to bow each other to show the expression, I mean, that as a part of the greeting. So it's normal things for us to be able to, whenever, I mean, when this COVID-19 was announced and then was ordered to stay at home, everybody had, although of course they, especially those working, were really reluctantly to take this order. Not order, it's a request. Frank, by the way, that there was no request. I mean, there was no order. It was only request. So those who didn't want to follow that, you know, request, you could have gone out. But a lot of people stayed at home. That's for sure. There is another fact that we know that is this education regarding this coronavirus or COVID-19 have been intensely done to inform the people about current status of this coronavirus the situation, and also the figures, and also, of course, recently that they finally state of emergency, nationwide state of emergency has been lifted, because due to the fact that, you know, such lower figures in terms of coronavirus infections have been detected. So it was what I think was 3 to 4 weeks, 1 month, I don't remember, but anyway, this state of emergency had been declared almost a month and a half ago. Anyway, it's these things have been lifted. That's why, although I see the surge in the people going out and going to work, and of course the economy cannot be stopped. I mean, if you suspend that economy for many months, you would ruin entirely the whole economy. So we have no choice but have to go out to start working. But still, they relatively maintain the social distancing, and also the fact that people do not speak that much while riding a public transportation. For example, trains or buses or whatever, they normally don't speak loud. Even they speak, just like whisper. It's part of the social etiquette. That's the way we've been taught. When in public, you should not speak loud. If you have to, you can whisper, or you can speak very low volumes. So, and another thing is the mentality, or Japanese mentality we have, is that the causing trouble for others is taboo. You're not supposed to make trouble for others. This also considered sort of disgrace to your family name. So you always try to avoid that, causing such trouble to others, for others. And but one thing I'm a little worried about is the fact that this people, of course everybody thinks that way though, is catching the COVID-19 would lead to be viewed negatively by others. This phenomenon is taking place, especially conspicuous, especially among family members of those health workers, such as nurses and caregivers and doctors. And some so to the extreme cases that some of the children of this nurses were told by their principal of some the kindergartens or even elementary school to stay at home rather than come to school because you might be infected with this coronavirus. So that's a really sad thing. But these people have been working for you, for the people of the Japanese. But they're bullied by those who have a wrong idea and then who have a very biased opinion about these health workers. I didn't cover that. Okay, I see I'm reading the memos. Okay, sorry about that, but it's because I don't know much about it. As of today, the total of the infections in Japan stands at 16,884, and 892 people died from the COVID-19. Okay, so I think this can be said. That's the reason that these cultural traits, cultural practices, bowing and not wearing the shoes in the house, talking low volumes in public places, and also love to have the clean environment, and not causing any trouble for others. Are these one of the factors that but perhaps that has led to low figures in Japan, in terms of infections and death related to this COVID-19? Okay, that's about it. I hope that will help you understand this situation, why in the world that in Japan's figures related to the coronavirus is so low compared with other countries. Thank you very much. Bye now.